Hi everyone, welcome back to my channel. So today this is not a Pokemon video, this is gonna be a nursing related video because I'm in nursing school. So I'm in my junior year now in nursing school, so there's gonna be a lot of like medications that we have to be familiar with. So I think some of the people take advantage of making drug cards whenever they're studying for the program because of the it's helping them to understand more about a certain medication and like being able to relate in how to take care of patients using those medications. So in this video I'm just going to explain like what is the basic format that we use in my school. Again, it may vary to a different nursing school or a different person on what makes sense to them and what makes it easier for them to memorize. But for the common ones, like standard format for a drug card, you're gonna have to like put the name of the medication. It can be the generic name, or it's gonna be the common name, and then the next name would be the brand name or a trade name. This is the name that you actually hear during advertisements, like seeing it in televisions. Those are like the companies that will actually like make the drugs, right? So it's gonna be the brand name, and usually the brand name starts with it's capitalized word, so it's gonna be the brand name. Also, the classification of the medication, is it uh, whatever purpose it's gonna be antipyretic, or is it so on and so forth. And then mechanism of action, what does the medication do for our body? So you have to explain that so that it's easier for you to understand. Like it's gonna be like lower the pain or reduce the pain level, or it's gonna restrict some of the enzymes that is being released in the system inside our body. And then they use like what's the purpose? Is it for like a bacteria? Is it gonna be for a fungal infection? Is it gonna be for uh, a different purpose, right? So it's gonna be, and also the use of the medication, also the nursing implications. So as a nurse, you have to uh, understand that when you're giving the medication, what's gonna be your job, or what kind of be like the assessment that you have to perform for the patient. Are you gonna be checking the vital signs first before you give the medication and hold it? Because example, like the Joxin, like if it's below 60, the you're not the systolic pressure, you're not supposed to be giving that to your the patient if they're bradycardic, and so on and so forth. So you have to be aware of like any allergy reactions that the patients have, and so on, and etc. Right? Complications. So it's basically the side effects. So what is the side effect of the medication? Is the patient going to have a rash? Is the patient going to have a GI upset or any reaction to the medication, right? And then if they do experience those symptoms, then they have to notify you so that you can report it to the provider. And lastly, the contraindication. So basically, for this, because some of the drugs that you might be giving to someone might be interacting with a different drug or food. So that's why, like, when you're doing interviews with the patient, you have to know like what medications they're taking, what food they're eating, or like, because again, there's gonna be a chemical reaction inside the body. So you don't want to have the chemicals inside either make it worse for the patient, or if it's interacting, it might reduce the therapeutic effect, or you don't want any like adverse reaction to the patient whenever you're giving something. So yeah, so this is like the super easy format, like that people usually follow. Again, it's up to the person or the nursing student to actually use whatever works for them, because at the end of the day, you know, you have to be familiar. Because like if you can memorize the drug, then better. But you also have the other reference that you can use in practice, such as your drug book and the actual system that has all the medical information that you can actually like review and look up whenever you're reviewing the medication before you administer it to the patient. All right, guys, thank you for watching. Take care.